Hi, my name is Jamaal Jones, and I'm the principal attorney for Jones Health Law. Thank you for taking the time to look at today's YouTube video. Today we're going to discuss blockchain and whether or not blockchain belongs in healthcare. Healthcare providers have been slow to implement blockchain into their practice. Providers are hesitant due to unfamiliarity with this technology and how it works. Some don't see its practical application to healthcare. Others are employing the wait and see approach to determine if it's financially rewarding. And some are put off by the lack of regulation, which could expose their patient records to cyber theft. So now you might be asking yourself, well, what exactly is blockchain? Well, in 2009, blockchain stormed onto the scene as the foundation for swapping digital currency, or virtual currency, as it's sometimes referred to. Blockchain is a permanent record of online transactions or exchanges that are logged publicly and in chronological order with corresponding time stamps. A blockchain is comprised of a series of blocks of information that grows over time to create a chain. Blocks cannot be altered or deleted, which allows users to follow the crypto trail or transaction record. Blockchain is appealing to many in the healthcare community because of its potential for data security. Credential users can add to the transaction record, which can then be dispersed or shared across networks. Users on the network can validate or confirm each block of data in the chain. The key element of blockchain is that it's not housed in a central database, and all transactions must be encrypted and verified by the network. So the next question, I guess, is, well, how will blockchain revolutionize healthcare? Well, data security and data interoperability are two of the most popular uses for blockchain in healthcare, but there's a potential for many other applications. Blockchain can be used to create a uniform database of protected health information that is easily accessible by healthcare providers, regardless of the type of electronic health systems that they use. Blockchain will provide greater security and privacy for patient records. It'll reduce administrative processes, which will allow for more time spent with patients, and it will facilitate the free flow of medical research between providers in the treatment of diseases. Blockchains do not have to be publicly available to everyone. A healthcare facility may limit its network to users that they authorize, such as HIPAA, covered entities, and other trusted collaborators. To increase data security, a healthcare provider may place restrictions on what is on the blockchain while choosing to keep other information off of the blockchain. Additionally, safeguards must be in place to protect personally identifiable information without significantly inhibiting the transfer of protected health information. More functional data sharing between healthcare providers increases the likelihood of accurate diagnoses and better treatment for patients while reducing the cost of delivery of care. Also, you can be sure that the information on the blockchain is accurate and secure. Blockchain will revolutionize health information exchanges by providing patients with direct, continuous access to their medical records. Providers will be able to access healthcare databases on a large scale in ways that they haven't been able to do so before. It will also facilitate communication between primary care providers, specialists, and pharmacies who all coordinate care for a patient. All providers, payers, and pharmacies can record information about a specific patient, such as patient visits, prescribed treatment, and diagnosis onto the same ledger, which they can all access. This communication reduces abuse, misuse, and readmissions. I guess the final question would be, is blockchain safe? Well, transactions are conducted over several computers and not a single server, which makes it more difficult to change, hack, or forge. Cyber criminals have already found a way to abscond with millions of dollars worth of coins in several creative ways, but experts still believe that blockchain can be a much more secure method of storing patient records and other information. Blockchain wouldn't eliminate data breaches, but If the right procedures are implemented, it could significantly reduce the occurrence on a large scale, as we've seen in the past with companies like Target and Aetna. However, many questions related to HIPAA and blockchain remain. For example, providers are unsure of how to incorporate patient bill of rights into HIPAA through blockchain, and who would have the right of access to records maintained in the blockchain or on the blockchain. Many contracts will have to be amended to allow for blockchain before they can surmount any lingering legal obstacles. As of today, federal and Florida legislators have not passed any laws that regulate blockchain in any meaningful way, but that will change as more providers adopt this technology. You need an experienced healthcare attorney who understands blockchain and data privacy to ensure that your practice isn't violating HIPAA, high tech, and state or federal agency rules. For more information, call myself, Jamaal Jones, at 305-877-5054, or you can email me at jrj@joneshealthlaw.com about this topic or any other topics that I've covered in the past. Feel free to reach out to me here on YouTube as well. Leave a comment in the comments box, and please remember to subscribe to my channel. Thank you.